My role is to see the women on the postnatal ward. So after they've actually delivered their baby, they ask questions like, can they do hoovering, can they go up and down stairs, how do they put about pushing prams. Our aim is really just to make things easier for them, give them the confidence that they're going to manage once they get back home, and also give them gentle exercises to help them recover and get their muscles back nice and tight again. The exercises that we give are all very gentle exercises, and those exercises are there to get your pelvic floor muscles and your abdominal muscles starting to get stronger again, because they've all been weakened and stretched just with being pregnant. So we look at your pelvic floor muscles, getting them nice and tight again, and that is more to do with them making sure that you're getting good control of your bladder and your bowels and don't have any concerns further down the line with incontinence issues. Your abdominal muscles, we look at gentle exercises such as just knee rolling from one side to the other, pelvic tilts, and also small sit-up movement for your long muscles that go up and down. Going home, it's just really about just watching what you're doing, just listening to your body, and just taking things a little bit more easy. If there's people there to help, do the more strenuous tasks, get them to do that, and rest when you can rest as well. Hi, I'm Elaine. I'm the assistant physio practitioner that works in the postnatal ward here. I'm just here to give you a little bit of advice just how to make it more comfortable after your caesarean section, and also to give you some gentle exercises just to aid your recovery from your operation. So, is that okay if you just go through this leaflet? So we've got two leaflets. We've got this one that gives you the advice about your section, and also this one for exercises. So first of all, we'll go through this leaflet here. So first part, just really looking at how to find a comfortable position for yourself. Everybody's different, so it's just a little bit trial and error. So you can either be sitting with your back against something nice and firm, just make sure you've got plenty of pillows to support your back. If you're lying flat, it's a little bit more uncomfortable to start with. So if you just pop pillows behind your knees and your thighs, that gives you a bend just across your wound area and makes it more comfortable. You can also try lying on your side. Just remember to put a pillow between your legs and pad some pillows round about to make it more comfortable there. Okay. After surgery, you can also have some chest phlegm on or a sore throat. If that's the case, we'll teach you how to cough. So the best thing to do is either just support yourself around your wound area with your arms, or take a pillow and hug that pillow to your wound area, or bend your knees up, and that gives you a little bit added support as well. If you do find there's some phlegm sitting in your chest and you can't cough properly, you can do what we call huffing. So that's taking nice deep breaths, just in through your nose, out through your mouth. Do 3 of those, and then a huff is just like you're steaming glass up. So it's like that. Because after surgery you're not moving about as quickly, and you don't want that sitting in your chest because you don't want it to turn into a chest infection. Okay. You also have to look at your circulation, so you'll be given stockings to wear, and you've got to wear them for 4 to 6 weeks. And then you can also do ankle exercises to help with your circulation. So just pointing your toes forward, so if you point your toes forward, then bring your ankles back the way, and then do circle one way and circle the other way. And just keep your legs moving about in the bed while you're lying down, so just bringing them up and then putting them back down, like that. And once you become more active, that will just become easier. Once you're back home, you won't have a bed that helps you get up and lies you back down. So it's just all about taking your time to get out of bed, take nice deep breaths. If you bend your knees up for me, then if you bring your arm over your body and roll onto your side, and then if you bring your feet over to the edge of the bed and then push through your hands and your forearm to help you get up to sitting. Once you're up sitting, just give yourself a minute and then use both your hands just to stand up onto the floor. Now just get back into bed, it's the opposite. So if you just step one back with one leg, reach back, sit down with your hands, make sure your bottom's quite up high near the pillow. Then if you give your support with your other hand, lie down onto your side and bring one leg in at a time into the bed. Advice for walking is you've got to remember and try and stand tall. So that just, if you try to stoop, which is just natural because you've had the operation, it can make your wound area more uncomfortable. So just try and get your shoulders back nice and straight, even if you soften your knees to start with, bring your shoulders slowly back, then stand up. When you're at home sitting, sometimes chairs can be quite low or soft, which makes it difficult to get out of. If that's the case, pick a firmer chair initially to sit on. Use your hands to bring yourself up to standing as well. When you're feeding your baby, the midwives will give you advice on correct position, but also make sure your back's well supported, just with plenty of pillows. Driving, you're not allowed to drive for 6 weeks, and that's just because you've had surgery and it's just in case you ever have to do an emergency stop, but also your concentration is not at its best once you've had a section, any kind of surgery. Exercise after your caesarean section, the best type to exercise to start with is walking. It's nice, it's gentle, you can build up your distance slowly, you can build up your pace slowly, just listen to your body. Once you've had your 6-week check, you can actually go start swimming, but we recommend that you don't start anything really strenuous or physical for the first 3 months. For the first 3 weeks, the heaviest you've got to lift is just your baby, and then wait another 2 to 3 months before you do any other heavier lifting. Okay. Don't bend over from your waist like this. If you have to pick anything up, try bending down with your knees like that, and even if it means having to use like a table, a worktop, something to help you stand back up. So are you okay with that information? So we'll go through the exercises. These are really gentle exercises, and you can start all these exercises straight away apart from the last one, and that is day 5 that you start that one just because you've had the caesarean section. Okay. So the first exercises are your pelvic floor muscles. Basically your pelvic floor is like a broad sling, and it goes from your front bone all the way through to your back coccyx, and this supports everything in your lower abdomen, and that's your bowel and your bladder, and they've just been stretched just during pregnancy and giving birth as well. So what we'd like you to do is you need to try pulling up that muscle, so just squeezing up through your back passage and through your front, and just try holding for 5 seconds. Always relax for 4 to 5 seconds in between each one. Just try doing maybe 3 to start with, then gradually build that up to 10, and then over the next 6 to 8 weeks increase that 5-second hold to 10 seconds. Try and do that at least 3 times a day. So whether that is morning, afternoon or tea time, but sometimes it's better just to try and do that once you're feeding the baby, that way you don't forget about them. Okay. A good test in 6 to 8 weeks time, just to make sure your pelvic floor muscles are getting nice and tight again, is if you need to go to the toilet, or if you've got half to full bladder, before you go to the toilet, just stand on the spot, pull your pelvic floor muscles up and have a jump up and down, and just make sure that you stay dry. Now, this exercise is really important because you want to make sure these muscles get nice and tight again so you have no problems further down the line just with incontinence. Okay. So the next exercise we're going to try is knee rolling. Okay. So you have your knees bent up and just put your feet just as comfortable to your bottom, just as you feel right. What I'd like you to do is just try pulling gently your tummy button down so you're flattening your back down against the bed. Then with your knees together, gently roll your knees over to one side, keeping the control of your tummy muscle, and just as gentle and just as comfortable as you feel. Then slowly come back up to the middle, and then relax in the middle. Pull that tummy button down again, and then gently over to the opposite side. And then back up to the middle. Second exercise is what we call a pelvic tilt. So we're doing the same thing again. You're pulling that tummy button down, flattening your back against the bed, and then just gently giving a small lift to your pelvis up to the middle. Once you get up, just hold that for 5 seconds and then relax. Does that feel okay as well? So those two you can start straight away, and this is for your muscle that comes across the way from here to here, and that's your corset muscle, and that helps support all your organs and also your spine. So it's a good one to do because obviously your back muscles have been all stretched, and this makes sure you get good strong muscles to support your back and have no further back problems. So that exercise, what we recommend you to do, it's best to do a few and often to start with. So every 3 hours do 3 knee rolls one way, 3 knee rolls this way, then 3 pelvic tilts in the middle. Gradually build that up to 10, then you can space that out about 2 or 3 times a day. Now the last exercise, and this is the day 5 exercise, and this is for your abdominal muscles that go up and down the way. Now these are long muscles and they're like elastic bands. So we start off together, and then as your baby grows they get stretched out, and once the baby's born they don't always come right back in together. You can sometimes have a gap in the middle, and the size can vary. It could be a small gap, it could be a larger gap. So this exercise is to get these muscles nice and tight again. So what we're doing is we're keeping our arms down by our side, we're pulling that tummy button in again, flattening your back, and then all I'd like to do is just gently lift your head up off the pillow and your arms just up by your side. And just hold for 5 seconds. And then relax. Is that okay? When you're pushing the pram, changing the baby, feeding the baby, just make sure that you're getting nice and tall, pram handles are at a good height, and you're not bending over. If you need to sneeze, laugh, cough, a good idea is just to pull up that pelvic floor muscle that we talked about, and that gives you a little bit added support. If you do find that you're having any problems with your bowel or your bladder, don't be embarrassed. Mention it to your midwife or your GP, and then you can get referred to the Women's Health Pelvic Physio, and they specialise in helping you with that area. Okay. The advice is to drink plenty of fluids, 1 to 2 litres of water a day, and also to just avoid straining just for constipation. Now it can take a good 3 to 6 months for your pelvic joints to get back to normal, so it's just really about all listening to your body. You know how active you were before, so just gradually introduce exercise and just keep it gentle.